I think hopefully just to kind of start this off is just to say, this is one of the things that we do at OPHB is try to help physicians that are in need of help in a variety of different ways, from behavioral issues to substance abuse to mental health and even physical health. So hopefully this will be something that we can really relate and give you some good information on. And I'm going to have just some slides. We're going to kind of focus on three different points, kind of what constitutes kind of a need for help or a problem that needs to be addressed, ways to approach somebody, and then finally what happens if we don't do that. I'll use a short video in this to kind of also describe, just kind of help, give ideas and strategies to, and then learning how to kind of confront or address somebody. Bear with me too, I have a little bit of a cold, so if I have to pause a cough or whatever, I apologize on that. It's been lingering. I've got 3 children at the house, so they bring all kinds of bugs home. So let me share this screen real quick. I'm gonna make sure they get the sound on, so when I do get to the video, that'll be available for you. And the first thing is, I'm hoping you guys see it. It says it's shared. Is that we're going to go into. Let me make sure I can move my slide along. There we go. Just kind of move along to those 3 points I talked about earlier. Kind of what constitutes concern. What are the potential challenges of addressing or confronting somebody, and what happens if help is not sought. I'm going to kind of break down each one of these topics as we kind of go through it, and just talk briefly about them. I'm not going to spend a lot of time on like each one of those problems, but because this is about trying to get to the solution. But I think it's important because you guys are physicians, and physicians have kind of different expectations when it comes to when you're struggling with something, like a mental health issue or stress and burnout that's having an impact on, your work environment, or even say a substance abuse issue, or any other kind of impairment or behavioral or even personal concerns that kind of creep into the work world because, those kind of, if something happens where I'm distracted, at work, those kind of errors can have a big impact. So I think it's important just to kind of address those kind of needs and concerns at first, and then get into the, ways that we can kind of learn how to help and address somebody. The first thing is here, we kind of go through what those concerns are, right? The first one is, just talk briefly about addiction. I think most people know OPHB because we do monitor a lot of the one-bite participants that are confidential from the medical board that are seeking help for substance abuse. And that's a really important thing to know about. If you know a peer that is struggling with substance abuse, there is a path that allows them to seek help without having to be reported to the medical board. It does come with some rules and stipulations that are just part of the law, but we can guide people through that, and we're a good phone call. Say if you get a DUI or something like that, we're a good phone call to get to kind of how do I address this so I don't find myself in trouble with the medical board. But I think even the bigger questions, if you're trying to help somebody, is how do I know if somebody has an issue? I would tell some, especially with things like mental health or addiction. I mean, if you have that gut feeling like this seems off or this doesn't seem normal, I think those are usually good signs. Like that gut instinct is a good thing to kind of be able to say from a peer's behavior that doesn't seem quite right. The big question I throw people when it comes to drinking or alcohol is that's something that people do socially, a lot in our society. And the question is, when does social drinking become a problem? And, there's a lot of definitions about when people talk about what alcoholism is. I think one that the clearest ways to say is not necessarily how much somebody's drinking, but every time they drink, that seems to be when the problems occur. That's probably a good sign that there's probably a substance use issue going on there. And obviously, the other one is kind of these controlled medications. My experience with peers that are struggling and have these concerns is that with that particular problem is that physicians have access to controlled medications, and that really puts you in a lot of jeopardy if you get obviously caught with that stuff, because you're breaking the High Medical Act if you're abusing any of those. And so what we try to do is, if that is the issue, it's always important to get ahead of this and give a call to us. And, we'll talk about the kind of confronting somebody or challenging or addressing them in a couple slides. Next one, and just kind of briefly talk about, is another concern is mental health. Mental health is one of those things. If you have a disorder or a diagnosis, you're taking medications, is that something that has to be addressed? Is it just by that in itself, is that something that's a concern to address? And I would say no. I mean, ultimately, the person's taking care of themselves and doing what they do that in itself. But one of the challenges like mental health, just like addiction, is there's a lot of denial, and people sometimes act out in behaviors because of this cognitive disorder that they have, and it's really important to be able to address that so they get the appropriate help, get the appropriate medications. And people aren't necessarily needed to, that's not something necessarily needs to be disclosed as long as it's not impeding or impairing somebody's ability to work. So addressing that is something that there's an avenue to do, because as long as it hasn't crept into patient care, that person should be able to seek help without any concern. But there aren't any regulations around that, although that is going to be changing in the near future with the medical board. Next one is kind of stress and burnout. I mean, again, this is something we did a whole presentation on. That I think is a huge topic right now. We're doing a lot of work, both in coalitions with all the associations, and I know there's regional coalitions going on trying to address stress and burnout. There's surveys out there that I know the OHA has put out that's kind of looking at the concern and the numbers out there. The reality of it is that's a big one that we're facing, and that's one of the things that really creeps into behaviors. When somebody gets burnt out, that means they are empty and apathetic. Stress is normal. People have expressed, and sometimes we can be overstressed. And if we can develop good, healthy coping skills, we can get through that. But when we get to the point where our stress turns into burnout, that means we are drained, and we have nothing else to give. And that's a real problem, because that shows up in behaviors like not showing up, making errors at work, isolating. And those are things that obviously need to be addressed. I would say stress, hopefully beforehand, is being addressed. When you see somebody's like getting agitated, overwhelmed, that you can see them being kind of in that place where they just can't get settled. That's a time to be able to address before they get to that burnout, because once they're burnt out, it's hard to bring somebody back from that kind of emptiness feeling. Of course, there's other behavioral issues and one of the ones we run into a lot when we're talking about learning how to help peers is we end up getting situations where hospitals have scenarios where there's a lot of complaints about a physician's behavior, and so they just send them to us and evaluate and say, fix that. And it's something to do with like personality clashes, personality styles. And one of the things about it is we can do stuff and address and counsel and kind of work on those issues, but it'd be nice if internally we were able to help like peers be able to help peers address things like, hey, when you approach that person that way, they may have felt this and that, and kind of learn how to kind of coach internally with each other, so it doesn't get to places where there's discipline involved, or actions or requirements that somebody has to do in order to get their credentialing. So those are just kind of like just some broad topics that I think are important just to kind of mention before we get into the actual how do you help somebody get help component of this, just because I was talking to Kate and Caitlin beforehand, being healthcare professionals, everybody's got challenges and struggles, but with you guys, those struggles, if they impact your work environment, can have great consequence. So we really want to see that not happen, and find ways to address it and be preventative. When we start seeing the signs and symptoms of somebody being overwhelmed, which we did a whole course on that, stress and burnout, when you start seeing people, behaviorally being disengaged, isolating, being agitated, being withdrawn, those kind of things, how do I start getting in there and start talking to them about those concerns? And how do I talk about things that may be uncomfortable to talk about? And I think that's part of what our next section is the kind of, what are the challenges in addressing somebody? There's kind of these unintended, like tangible consequences or potential challenges. I call them unintended consequences, that if I address something that is concerning, could there have an impact on their work? Could it have an impact on their license? Could it have an impact on their credentialing or their family or some of their personal life stuff? Maybe. Anytime we address something that is concerning, and usually when people are addressing something concerning, it's because it's demonstrating itself in behaviors and actions. There's always a risk that, by exposing something, or when you address somebody saying, if I'm going to set a boundary with that person and they don't follow through on what I'm kind of asking them to do, I might have to do something that is difficult. But ultimately, our goal isn't to, our goal is to get the person better. I mean, one of the things that I hear frequently, and I did a presentation yesterday with a physician that lost his license, but they were in a place of that being well or positive because they were well, and they knew that the gift of being well was more important than any career or any kind of thing that we kind of just put more value on than our own existence. Now, that's not what we want to see some people lose their license, obviously, but we definitely want to make sure that your wellness is the priority over some of these other things. Some of those other things can get resolved if there's challenges or something that needs to be addressed. But you know, if you don't take care of you and there's that concern, or if we don't confront somebody that needs help, we can really put somebody in jeopardy with their life in multiple ways. You know, so what are kind of some of those kind of personal roadblocks that we get in the way of being able to help somebody? You know, so you know, confrontation is a difficult thing in itself, and why this is, you know, this title is like, you know, how do we, you know, helping, you know, how do we help somebody that that needs help? You know, part of that is going to, in helping them, I'm going to have to talk about something that probably isn't really comfortable, and so I got to have strategies to deal with that. And the first thing to really talk about is, you know, how are you empathetic, or how can you be empathetic but committed to what you want to say? It's like, and this is I deal with that on a daily basis. It's like, I want to come across as I care and I'm concerned and I'm listening. Same token is, there's a goal I want to achieve here, and there's something I want to be able to get across, and there's a message I want to hear. And sometimes that message is not only that I want to say that I'm concerned and I want to see you get help, and here's some avenues maybe you could take to get that help, but how to be able to stick with that and say to somebody, like, I need you, you know, if there's this concern, and I hope you get help, and if you don't get help, you know, I may have to talk to somebody else about this, and that can be a real challenge depending on what the situation is. And we were talking, some of those are bigger issues, some of them may be things where that isn't the next step to take. But you know, anytime we're asking somebody to get them to get help, we want to see them follow through on that. And so how do we have ways to kind of encourage them to kind of commit to that? And what is your commitment to that help? You know, and I think it goes on both ends, not only about if you don't do something, especially if something seems serious, you know, how do we kind of, what's the next step you might have to take? But it's also to say, when they agree to do it, what I can do to be supportive of that? How can I be part of that solution for them? I mean, ultimately, we're not asking you to be the actual help for the problem. We're just saying, how do I help? How do I get to somebody's attention to make them aware that I'm concerned? How do I make them aware that I think that this needs to happen? And how do I do things to help motivate them in a empathetic, gentle way, but a committed, you know, way? And it's part of it's challenging that discomfort. You know, I've done this job for, I think, the last 16, 17 years of my life being a counselor. And, you know, it's still, there's times when there's issues that arise that can make discomfort. And I know this is going to have to challenge somebody. It's going to be, it brings up kind of feelings in me. You know, that person I have a positive rapport with, it's going to have a little bit of friction kind of go here, but that's okay. I've learned through life, and I imagine most of you have learned through life, that change takes discomfort. You know, usually how we know we're changing is because through discomfort. Just like when kids are growing, like, you know, they go through growing pains because there's a discomfort because they're changing, and that's the same thing with emotional growth. There's a discomfort when we're changing. And then the other part that's really kind of challenging with confrontation or addressing something is the person might respond poorly. And that's okay. We're going to talk a little bit more about kind of resistance later on. In fact, resistance is a normal response. It's not so much the concern of the person being resistant, it's more the concern about how do we handle the discomfort of somebody not liking what we may have shared to try to help them get to a better place. Other concerns there, right? If you become the person that's, you know, reaching out and trying to help someone, does that put you as like, that's the tattletale, that's the person that you can't tell them anything, because then they'll go and they'll say something to it, or they'll kind of make you, you know, they'll challenge you in some way. And it's like, you know, it's one of those hard things to be like, I think we are very concerned about what peers think, and we want to have constructive environments. And I think sometimes we want to be able to give people distance about their stuff to figure out. But if there's things that are like, you're concerned enough about a peer at work that, you know, you're seeing an impact on their performance or their behaviors, or they're bringing in a lot of negativity that's having an impact on your coworkers, stuff like that. I mean, I think you just have to be able to do the things not only for yourself but also for the environment and that person. I mean, it is critical to be successful in a healthcare environment is that you have a positive working relationship with people. And if somebody's struggling, it's critical for that people get around and be able to help and support them through that. And so while there might be a discomfort in that, some people might not appreciate it the same way. Ultimately, if a person gets well, that impact will have a greater response to the situation. Have a better response than the kind of the initial kind of maybe scoffing that, oh, I can't believe somebody would say something. And then, one of the other challenges I've found with confrontation or with trying to address somebody and their need for help is that a lot of times if I'm saying something to somebody about their needs for help, I have to sometimes ask myself, is that something I need to look at too? And it depends on the issue, right? Some issues are clear, clearly I don't have that problem. And there's things like when it's behavioral stuff, it can be like, I'm challenging this person on the way they address somebody or the way their attitude or how their agitation towards things and how that comes across to the patients or to other coworkers. I have to ask myself, do I have that too? Is that part of the reason why it's hard for me to say that? Because I don't want to be a hypocrite. And what does that mean? Does it give me an opportunity to grow and look at my own kind of stuff that I have going on that would help me be more productive? And then just want to kind of go through a couple steps of talking about, just breaking down kind of what empathetic confrontation would look like, and how do you prepare for that? The first step there, it's kind of step by step, and I'll kind of just kind of briefly go over each one. It's important to know if you have a concern and what you're going through, why am I doing this? And what's the goal you're trying to accomplish? Why do I want to do this? Partner, X is challenging. He's coming in late. There's a lot of agitation going on, being short with staff, being short sometimes with patient, making maybe a few errors that wouldn't be the same case. What I want to do is be able to, the reason I'm asking this is because I want to know as a human, how are you feeling, what's going on, what can I do? And also B is, so we want to improve the environment that we're at. And if there's a way this environment can help, whatever the scenario is. So why am I doing this? And be clear with yourself why you're doing that. And evaluate what you're thinking and feeling about that. What's going on? Does it make you uncomfortable? Are you fine with doing like that? When you think about it, does it agitate you? And then be able to process some of those emotions so you don't bring, when you're confronting somebody or talking to them, you're not bringing in that baggage. You process that beforehand. Decide what you want to say. Sometimes it's really important to write down some main points and ideas. I think that anytime I think I have to address something important, it's always good to have that so I don't miss something and I'm clear, and I don't also get derailed, especially if I don't get the response I'm hoping for from the person that gets really resistant or agitated, that I can kind of keep myself on track. And you get a variety of different ways people respond to that. They can be really resistant to it and could be aggressive about it in the sense that they could be agitated, angry. Some people just being apathetic and just hear it, but then you don't see any change. And that's, being passive about the confrontation. And both of them are obviously forms of resistance. Make sure you get through it says anger, frustration, subside before, goes back to that first part. Just make sure you process your emotions before you go in. So you're going in as the caring person, not your own baggage that's kind of, you're dealing with the situation being the forefront, because that'll just get lost. It'll just become an emotional situation that won't get to what you're looking for, which is a concrete plan of action. And I think this is really important at the end. Visualize how you hope this would be, this interaction. It's meant to be positive. It's meant to be something that's going to be supportive. So when you are addressing somebody that's in the need for help, the goal is, we're talking a lot about some of the challenges that come in here, but ultimately you're trying to push things forward. And that to me is one of the best things when we get here. It's like we bring in challenges, we bring in struggles, and that just happens day to day with life stuff. But if we can, in our head, find ways to visualize the positives that are going to happen from this interaction, it motivates us more, and it not only more to be able to address the concern, but I think even when we're positive and going into things, people respond differently. Like we have hope. We're coming in with a solution. We're coming in with a goal. This is how I want to. This is what I would like to see happen. I think that really makes a big difference. That this why there's uncomfortable emotions that happen. Ultimately, when you're addressing a concern for a peer that needs help, you're actually doing a positive thing. It's a good thing. And even though it goes back to change is a good thing, even though it feels uncomfortable at times, we're motivating and pushing people in a forward place, and that's good. So this idea that when we get a little bit concerned and it gets uncomfortable, I know a lot of times our instinct is like we feel discomfort, pain, we want to do something to make ourselves feel better, but real growth happens by sitting there and learning how to process and go through with it. And so that's going to be kind of one of the things that we're talking about, breaking down this kind of empathetic interpretation is make sure that we remember this is a positive, it's supposed to be a positive experience. And then, just tangible things when you're trying to do this, this kind of addressing of a concern, propose a time, place, make sure you're talking to the person, be open, honest, keep composure. That's why you have to work through those emotions beforehand, and be prepared to listen. I think one of the things is sometimes I get this a lot when I'm working with physicians that I get told by like a committee or something like this. They just get, there's only one side. Here's what you have to do, what you do, and then there's not really any room for the other person to share what they're going through. I see that too. Also, when people go to like medical board meetings, it's there's a barrage of this is what the problem is, and then you get 5 minutes to explain everything yourself. I think that to be successful, you have to have time and make time to listen. Be an active listener to the person. They're going to come back, and there's going to be justifications, rationalizations for some of the behaviors and reasons why, and why they can't do this, or why they can't address this, or who else's fault this is. But I think being able to sit there and let them get that stuff out and listen to them, and then be able to, if you're coming in and kind of hear some of the things, be able to kind of also reflect back some of the, your concerns or the things you heard them say, and kind of get a better understanding, and maybe even a little bit of like being able to help them hear themselves back, be a little bit of a mirror. One of the things I've learned doing this job is that while me as a professional, I can help people, or my clinical staff can work and help people, people of like professions seem to have a really great ability to be able to be mirrors to each other and really give good feedback and understand and kind of have that shared experience. And so I think when you're trying to help a peer, you have a really valuable tool that even I as a professional don't have, is that you are another physician talking to another physician. And that is a unique experience in life and a unique occupation. And that gives you a great place that what you share and what you say and your empathy towards them can be really powerful in helping them motivate change. And again, don't be surprised if somebody gets defensive. But the point of this too is that you gotta stay your ground, be committed to what your plan was, and remember you're doing it from a caring place. You're not doing it from a hurtful place, and that's why you go through these steps to learn how to address it. Is that you're coming from a genuine concern in an empathetic place that has been worked through the emotions and being just kind of presenting to them what the challenge is, what the concern is, and how can we help you move forward with this. I think it's really important. Nobody's asking you to be the solution to the problem as much as help them get to the solution to the problem, which is the next page, right? The goal is to make the peer aware of concerns and places to get help. If that's a therapist, if that's a training, if that's a course or a book, if it's a bigger issue, if it's like a treatment, we help them get to a place that they can get the help, and you be supportive of them doing that. You're not to fix the problems, to get them to the thing and then help them, support them while they're trying to fix that. I think that's the best tool we can have as peers, is be supportive. I think there's a lot of, in my experience working with healthcare professionals, there's a lot of stigmas for having emotional challenges or mental health challenges or, other like substance abuse challenges. Like these are weaknesses. These are just normal human experiences people have. We all are emotional. We all have times that we need to lean on and have support. There's sometimes some of us just get more lost in it than others, and we really need others to pull us through, because the concern is if we don't, a lot of isolation occurs. you can always remember somebody's well-being is more important than external reasons not to help. It's always more important to help a person regardless of what maybe some of the concerns of being fearful of asking for, of addressing it, especially with the more tangible, kind of entities that might be around. Just real briefly, it's kind of moving along right here in this presentation. Some of the potential challenges in addressing right is resistance. I always just tell people, expect it, don't take it personally, and don't let it stop it from sticking to goals. I mean, resistance is one of those things. Resistance usually is a telltale sign that you're hitting somewhere close, because those defense mechanisms are coming up to try to protect the concern that, if it's whatever the pathology of thinking may be, they're coming up there to try to block that, and it's to be expected. You just kind of go with it and don't lose your ground, and kind of help that person work through that resistance, and there are techniques like motivational interviewing and stuff like that kind of help with the resistance. That's a whole separate course of ideas. I want to just play this video about the from the Happy MD talking about being able to address, a peer. I think it does a really nice job, thinking about how as I can help another peer and get out of that kind of another professional realm.
So here's how I recommend you reach out to a partner if you think that they're burned out. Now, the first thing you have to do is make sure that they understand that you're coming to them heart to heart as a real individual human being, not because you're a doctor or a colleague, or heaven forbid you're in some leadership position where you're a medical director. So what I recommend that you do is get a time when it's okay to talk to them. Hey, John, it's Dyke. Can we talk for a second? And John's going to say, yeah, sure. Now, what I want to do is make sure that he knows that I want to make a human connection with him. And so what I'm going to do is put my hand on my head. Go ahead and put your hand on your head with me. Put my hand on my head. I'm going to say, I'm taking my doctor hat off now. So do that. I'm taking my doctor hat off now. So that sends you a signal that you're stepping out of that role. It also sends your colleague a signal that this is not them talking to another doctor, especially if you are in an official leadership role. Hey, John, I'm taking my medical director hat off now. Do that before you do anything else. Otherwise, the chance of a connection is dramatically reduced. So, John, I'm taking my doctor hat off now. It's just you and me, heart to heart. I've been watching it and I'm concerned. How are you doing? To which he's going to immediately answer, how? Yeah, fine. That's okay. Is that him or his programming? Well, I'm going to tell you it's most likely his programming. But the key here is he doesn't have to break down and cry and admit everything's terrible or whatever. There doesn't need to be anything dramatic here. You're sending a very clear signal, though. John, I'm concerned. And if you ever get to the point where you're ready to talk about it, I'm ready to listen. Now, since you're very likely to get intense denial with the first time you reach out, and by the way, you have to expect it. It doesn't mean you failed, okay? Intense denial is normal almost all the time. I'm going to encourage you to be persistent. Don't make them think they got a target on their back or that you're stalking them, but every once in a while, hey, John, it's Dyke, taking my doctor hat off again. How are you doing? You're sending that signal that when you get ready to talk, I'm ready to listen. Now, your odds are best because of the gender biases between men and women being willing to admit that there's an issue. The highest odds of you being able to reach out to somebody and make a connection the first time are if you're a woman reaching out to a good friend who's also a woman. The lowest odds are if you're a man reaching out to somebody who's not a good friend of yours who happens to be another man. But the key is, if you suspect somebody's burned out and struggling, please reach out. Overcome the taboo. Take your doctor hat off. Reach out to them heart to heart and be totally prepared for intense rejection, because their programming won't let it be any other way. But do not let that stop you. Be persistent. Come from your heart. Ask them how they're doing. And eventually, if it's right, they may open up to you and you may forge a connection with them that is potentially life-saving. So if you think somebody's in trouble, reach out, take your hat off, and keep it up. Does that make sense? I hope that helps. I think that you'll find this makes a huge difference. and persistence will too. We can, by our efforts of reaching out and trying to take better care of each other, we can actually shift the culture of the workplace. And I encourage you to play your part in doing just that. That's all for now. Keep breathing and have a great rest of your day.
So, I think that's a good, nice little video. Kind of talks about some of the things we've already talked about. And I think, depending on what the concern is and challenges, there are times where you kind of you address it and you kind of keep persistent. And there are some concerns that, you need to kind of stick to on that one the first time. And, depending on what it is, it needs to kind of find a place to resolve. I know that part of the, what the Happy MD does is a lot of stress and burnout work and trying to help, that's kind of maybe a little bit more of that persistence of like trying to help change some of those emotional things that may not so much be like a substance abuse issue that needs probably a more immediate address. I also like that kind of part where he describes taking the docket. I mean, it's so important to get the human connection when we're trying to address something. I think that's why I did this step, went over those kind of steps of confronting somebody. He says you want to connect, you want to be there, you want to be able to be caring, let your kind of move some of your emotional baggage away so it doesn't interfere with their ability to kind of be somebody that's supportive and caring and trying to say, I'm here for you and how can I help you? And I see these concerns and here's why. And I'm going to keep on being concerned and I want to help you address these things that I'm noticing. So I thought that was really a nice little video, just kind of summarize some of the stuff. And he talks a little bit about resistance, and that is sometimes just part of the challenge of helping people make change. Right, just quickly before we end on this presentation, what happens if the help's not sought, right? If individually, most likely if we don't address the concern for that person that's struggling, it's going to get worse. If it's less unaddressed, there could be a huge consequence that would occur that has ramifications that maybe not be so easy to bounce back from. And, and it creates isolation. And I think isolation is such one of the more challenges when people are struggling. If we don't say anything and they continue in their problem, they just get buried further and further, and they're harder to pull out. So we want to not allow them to get too far gone, so we can kind of be able to address the situation without having it be too far of a hole to climb out of. For facilities and patients served, right? If things aren't addressed, it could lead to legal or financial problems, patient errors or complaints, and then healthy work environment, right? When somebody's struggling and it's like it just creates not a positive environment. So how can we all be able to get there? Because when we're all succeeding, that makes that's the best level for success and enjoyment into what we do. And then finally, for yourself, if you don't address something, it can kind of really eat at you. I mean, like if something bad does happen to a peer that you're concerned and you didn't bring it out, you didn't kind of stick to even if you did address it, didn't stick to kind of the kind of goals you set for the confrontation, you can relate to feelings of feeling guilt, or you can be an enabler, or that kind of just feeling dishonest to yourself that you didn't kind of commit to what you wanted to do. And those are kind of lingering things that can really eat at us. So it's just important to be able to, on all facets, to be able to just be genuine, be real, and, be honest. And we live, hopefully most of us want to prevent, practice in kind of preventive medicine way. For me, it's with mental health, or you guys with physical concerns, and we want to address issues early before they get bad. Last thing is just a little bit of resources just to kind of put out there before I know there'll be a few minutes to answer any questions, or if you guys want to have a dialogue, I think that'd be more interesting to hear what you guys have to say. Obviously we're here at OPHP, we do assessments, referrals, coaching. We're working on even expanding to teletherapy. We do monitoring services, advocacy services. We are a resource. We're confidential. We are here for physicians. We're just kind of that first place to touch base, and then kind of, can we do something here? Do we need to branch out elsewhere? What do you need to do? What's the problem? Do you need other resources, other tools? That's what we're here for. And that's just a phone call. There's no service fee or anything for that. I mean, some people that actually do therapy or monitoring with us, there are some fees to that, but otherwise calling for us for research and referrals is just part of what we're doing. You have work EAPs, there's wellness committees and coalitions out there to tap into, and I think most importantly, other healthcare professionals, either peer-to-peer or even using healthcare professionals we sometimes forget to use like seeing docs or maybe a therapist or something like that to tap in for help. Anyhow, we've got about a few minutes left, so I'm turning it on to Caitlin and KK.
Yeah, thank you so much, Nelson. We do have a couple people asking some questions. First, I think is actually from your first slide. Would you be able to clarify the 1-bite rule?
Oh, yeah. That's yeah, it's not a problem. It's probably hard to explain in the last couple minutes, but I'll do my best. There's a carve out, so that everybody probably knows that impaired physicians can get action on their license. That's in the range from mental health to physical health to substance abuse. Those are typically the things that people get citations on their license for if those illnesses have creeped into their practice. The 1-bite rule allows physicians to seek help for substance abuse. It's a substance abuse only kind of a law rule to carve out. So they can go seek confidential help as long as they go to a board-approved facility, do a minimum of 28 days of residential treatment, and do 2 years of aftercare, 104 sessions of aftercare at a board-approved facility. Typically, that's a lot of information and a lot of confusion. So we usually say if somebody's wanting that help, or if a hospital thinks somebody, call us, we'll guide you to the right places, to the right people. And then what we typically do is we monitor the people afterwards that are confidential. So say they had a DUI that led them to get in trouble. We have advocacy and paperwork and documentation of their recovery, their absence, all that stuff. So when they have disclosed things to the medical board, they'll be protected. Or we just had 2 incidents happen the last couple of weeks where one of our physicians got a complaint about something else, and because the board came investigating, they found out that they'd been to substance abuse treatment, and we could advocate for. They went to the right treatment, they went to their aftercare, and they've been sober through drug screens for the last 3 years, 4 years, whatever the last cases were. So that's what it is. It's changing. The law just passed, a new law that'll modify that passed in February, and it's still working on the rules, but it should open the avenues to more people being able to get help.
Yes, that was it in a nutshell. That very good.
Yes. Go ahead.
Are there any other questions for Nelson?
And I will say that mental health currently does not have that kind of safe net, and it's really complicated to what is the board's involvement, or do they need to be involved in mental health stuff? It's not a black and white answer. They are proposing a new plan that there will be a confidential path for mental health, but it's still all internal. So I don't know. It's one of those confusing, you're confidential, but that's the board deemed you confidential. So then by the board knowing about your mental health, I guess it wouldn't be confidential, So right. I guess it's confidential to the public if that's it, but not necessarily to the board. So I don't know where that's going, but I know that that's in the works.
And that is a priority area for the OAFP, and working also with OPHP on the next steps to make the mental health parity for the 1-bite rule. So stay tuned on that.